Now I'm pleased to welcome to stage one of our co-hosts, His Excellency Ambassador Lazarus Amayo. Thanks so much. Ambassador for Kenya to the United States. Thank you, Ambassador.
Thank you very much, Margaret, for giving me the floor and the privilege I have today of making these remarks. And because His Excellency President Uhuru Kenyatta has already given a fairly comprehensive account on the status of malaria in Africa, mine will be a very simple one. That is simply to say, Excellencies, distinguished partners in the fight against malaria, ladies and gentlemen, let me join my sister Ambassador Hilda Sukamafunze, the African Union Ambassador to the United States, and the Executive Secretary for ALMA, Madam Joy, in warmly welcoming you to this evening's program and thanking you most sincerely for taking your time to join us in this noble cause of commemorating efforts towards ending malaria. Your presence is indeed a clear manifestation of your commitment in the fight against malaria, a disease that has claimed many lives globally, and a disease that is preventable and treatable. Malaria remains a major threat, as my boss has just said. And if I may just add one aspect, is that it accounts for almost 96% of global cases and 98% of deaths in Africa. And that is why when we are gathered here today, we have the distinguished honor of commending the efforts that have led towards the substantial reduction in infection and mortality rates, but at the same time acknowledging the challenges that still lie ahead of us. And as President Kenyatta has already mentioned, gains that had been made in the past have been partially affected by COVID-19. And so a number of our countries, in as much as we've been committed to ownership, knowing that Global Fund will not fund us forever, we have been co-partners as member states in also allocating budgetary provisions to take care of malaria and effects of malaria. But because of COVID, demand is there for partners like you to still stand with us in this noble cause. And if I give just a small example, in 2020, malaria accounted for 611,000 deaths in Africa. In 2020, 253,000 Africans died out of COVID. Even if you double the figure, because the reported case is 253,000, even if you doubled it, 510,000 people died out of COVID. Malaria is still a much leading cause of deaths in Africa than any other disease. And so we are gathered here to thank our global partners and to express our gratitude to them, to talk about the challenges we were mentioning, but to appeal to them for the Global Fund replenishment targets of 18 billion to be used to save about 20 million lives from malaria, HIV and AIDS, tuberculosis, and even reduction of infant and maternal morbidity and mortality. We are looking forward to continued collaboration with you in this noble cause. I've found during the social interaction here a good number of leaders and experts, professionals that have been to Africa, including my part of the world, very familiar with the situation and what is obtaining on the ground. We are looking forward to a time through you and through political leadership, when much more proper attention and significance will be given to malaria the way we have done to other diseases. If we were able to allocate more funds and develop vaccines for COVID in a record within a year, I believe if there was more commitment towards funding even research on malaria, malaria vaccine, and the likes, I believe we can be able to achieve much more in prevention, treatment of those that are affected by malaria. And so, since the greatest aspect of today is appealing to our global partners for more funding, like you say in other quarters, you don't preach to the choir. They know the situation obtaining in Africa. And we would wish to continue partnering with you in this noble cause to reduce the preventable infant mortality. Out of the 611,000 deaths in Africa, 80% are of children below the age of 5. Your efforts have really helped, but demand is still there for continued support. But we as Africans are also taking responsibility to increase our budgetary allocation in our ministries of health, because what we have at the moment is funds to facilitate, but eventually we have to own the process by also modernizing and upgrading our health systems. With those many remarks, back to Margaret. Thank you very much, and we look forward to continue the collaboration with you. God bless you.